Well, there's not a lot of places in Laredo where you can actually feel comfortable being yourself. Biller definitely is a place where I can socialize with people that are like me without thinking so much about, or what are other people going to say. It's definitely an important place for me.
Actually, we did not know what we were getting ourselves into. We've come a long way in the past 4 years.
To me, HIV prevention work was very black and white. You go out, you do community outreach, you get people to get tested, you share with them their status. If they're positive, you try to link them into care. If they're negative, you try to engage them in harm reduction activities, and then you move on to the next person. With community mobilization, I've realized you don't know where you're gonna end up. My name is Manuel Sanchez, and I'm a full-time employee with the City of Laredo Health Department, and I'm also one of the co-founders of Pillar. It's a local nonprofit organization that focuses on providing mental health services to the community and the surrounding areas.
My name is Arturo Diaz. I've been working in the HIV/AIDS field for 24 years with the City of Laredo Health Department, and now with the Pillar organization for the past 4 years.
Laredo, Texas sits on the border of the Rio Grande that separates us from Nuevo Laredo. During the course of the day, there's about 500,000 people in the city based on the migration of truck drivers that come in from Mexico, going to the northern states that pass through here. Here along the border in Laredo, we find that cultural issues and spirituality are two very influential factors that pretty much dictate how people conduct themselves. Most of the people in this community are Catholic. It makes it challenging to talk about subjects like HIV and STDs and even mental health or counseling services because they feel that those are issues that are only discussed within the home, if at all. In 2009, I remember it as if it were yesterday. Felipe Rocha and Brenda Howe from the Department of State Health Services in Austin called us here to the office. They started talking to us about this new project they were embarking on, and they wanted us to be a part of it. And we had no clue what they were talking about when they were mentioning community conversations or community mobilization. It was all foreign to us. But we knew it was something we had to do.
Well, it took about, I would say about 6 months. What we had to do is we had to invite people that we had been working with for many years. And again, that included the clergy, they included the LGBTQ community, the LGBTQ-friendly community as well, law enforcement, those that were HIV positive. So we had to get all their input.
We had been used to following templates. We had done protocol-based counseling training before, and everything was about following a script, yet this time around we had no script. But I remember both Felipe and Brenda telling us, you guys are doing great, just keep doing what you're doing. So I thought, well, this is some kind of talk show format where we just sit across people and talk and about their day, about what's going on in their lives, and in the end, I guess it's going to produce something. After 6, 7, 8 meetings, we started to see a common thread.
Time and time again, we would hear the same messages. We would hear stigma, we would hear discrimination, we would hear homophobia, we would hear bullying, we would hear suicidal thoughts, rejection, mental health isolation from family and friends.
And all of a sudden, we started to realize that there was a pattern, and everybody was telling us the same thing. We have nowhere to go for somebody to help us with this. So we realized that HIV has many faces. People at risk are not at risk just because they're engaging in high-risk sexual behaviors or illegal drug use, but people are also at risk because of unaddressed mental health issues. For a community this size, the population here is about 300,000. We have less than 20 mental health care providers. 90 to 95% only work with private insurance or people that are able to pay for their service out of pocket. What does that tell us? It tells us that most people don't have access to mental health care in this community. Something needed to be done to tackle that variable before we could really start reaching people in regards to their HIV risk behaviors. And so that's what we did. We set forth to create some form of organization that was going to bridge that gap in service care within the mental health domain. And eventually that's how Pillar came to be.
Well, since the inception of Pillar, I would say that we provided approximately like 3,000 individual counseling sessions, 600 group counseling sessions, 400 presentations to about 15,000 students. We also received approximately like 600 crisis phone calls via our 24-hour crisis helpline. And we've also done probably around 1,000 HIV tests out of the Pillar office.
At Pillar, we have a 3-tiered system of providing mental health services to anyone that is in need of such services.
My name is Miguel, and I am a counselor intern here at Pillar. I think that since we're nonprofit, we're provided that, I guess, liberty or freedom to truly serve our community. And when the need comes in, the community is telling us what they need when they're coming in through the doors, and we're trying to do our best to fulfill that need.
People here help you, they offer counseling services. I think that a lot of people need that sort of support. I was referred to Pillar, and I'm very thankful that I was, because this place has really been helpful to me.
During one of our periods of really struggling financially, we decided to reach out to the local United Way chapter to see if there was any possibility of us trying to tap into their funds to sustain the work we were doing under Pillar. So they asked us to fill out an application for funding, which we did. And to be frank with you, none of us expected them to say yes, because again, Pillar was an organization that was focusing its work on the LGBTQ population and issues that impact that community. Lo and behold, we got a letter saying that they were going to award us $10,000. We were excited, and we knew that now with United Way on our side, it was going to help us with approaching other institutions for help. I realized that we are our own worst enemy. I've been in this field for over 15 years now, and prior to embarking on community mobilization, whenever people would approach me about approaching the schools to have discussions on sexual health, about approaching political figures to get their support, I would always tell them that that was a no-win situation. No one was ever gonna open the doors for us to go and talk about these important topics with our youth. And so we were holding ourselves back. It wasn't until we tried that I understood there's people out there that also recognize that there is a need for change. There's people out there that know that our youth is vulnerable. And they did work with us. When we first embarked on community conversations here in Laredo, we had no idea where we were going. But as we listened to people, then we realized what it is that we needed to do. And by that point, we had already empowered our fellow citizens to join us and help us. Our work under community mobilization didn't mean we were just limited to this paid staff under the health department in the HIV realm. It meant now you had all these community volunteers that were not getting paid, but were doing it because they believed in the cause. So our army grew from 10 full-time paid staff to countless of community citizens that were all working towards the same collective goal.
Without Pillar, I just think that all these people who are, suffer them would probably not have a place to put everything in perspective. And they're gonna live the rest of their lives just letting the situation beat them down. So I think that Pillar is really, really important.
Well, let me just say that Pillar is making a difference, one soul at a time.